Thank you. My name is Jessica Hulsey Nickel, and I'm the founder of the Addiction Policy Forum. A little bit of...
Yeah, speak more into the mic.
Do I need to lean in more?
Probably.
Is that
yeah.
better?
Lean in.
Strangely soft-spoken, but like not metaphorically, just actually. So my name is Jessica Hulsey Nickel, and I'm the founder of the Addiction Policy Forum. And a little bit of background about us as an organization, because we're relatively new. We are trying to build the first ever patient advocacy group for this space. And our patient advocacy group is not just patients, it's family members, it's people with an active use disorder, it's those that are in long-term recovery, it's family members that have lost children, that have lost family members, friends, that are trying to support someone who is still struggling. It is a vast grouping of people who care about this issue for a variety of reasons. Now, it's amazing to me, because I've been doing this work now for a long, long time, that this is the first time we've actually brought together patient and family voices to make sure we're at the table and we're talking, because the rare diseases have a patient advocacy group. There's like a patient advocacy group for every rare disease, and then there's like a main advocacy group for all of the rare diseases. And how is it that we have a health condition with 20 million people struggling today, and we have never figured out how to make sure that they are represented and that their actual voices are at the table and that we're being listened to in research and practice? Because one thing I can tell you, and I was saying this to Sharon earlier, I feel like it's not that we're running in place, I feel like we're sprinting in place. Because the gap that exists between those folks that are in this room today and participating on this panel and the rest of the world and the general public is so vast. It is shocking and it is heartbreaking to me. And it is the work that we do every day to bridge that gap. We try to translate the science. We want our clinicians and our researchers to be famous. We want to follow the pathway of every other patient advocacy organization that has driven for more advancements and better rates of, we want people to survive this. We want fewer people to come into this disease space in the first place. And so that's what we're about. So we launched an awareness campaign 3 years ago when we started, when it was the 129 a day campaign. And then it became the 144 a day campaign, and then the 174 a day campaign. And now we are relaunching after the CDC gives us final numbers in a few weeks to probably be between the 197 and the 200 a day campaign. And those are the numbers of overdoses every day. That does not even factor in the alcohol-related deaths and other deaths. This is just overdoses. And the stories and the things that are happening in real families and communities, I want to share a few with you so you have a different perspective. So this is my friend Amy and her son Emmett. Emmett was amazing. He liked to ride his BMX bike and went to college and was on honors programs. He was a really good big brother to two younger siblings. His mom was his Sunday school teacher, great solid family. And in high school he started struggling with K2 spice. They thought they got him the help and he was in a good place. He went off to college. And she lost her son when he was 20 years old to a heroin overdose. After she lost him, she found out that he had had 7 overdoses reversed in local hospitals near his college, but there had never been treatment that began. There was not a warm handoff, a cold handoff, a hot handoff. There was an induction of buprenorphine. There was not notification to the family. There was not notification to primary care, to college health services. We had 7 chances to save Emmett. And we missed all 7 of those chances. That he did not find a hospital, an ED like Gales. He found sort of this common sort of thing we hear. It's sort of a catch and release, and you're back out on the street within a couple of hours after you have literally died and been brought back to life. And I feel that every day when I do this work, Amy and Emmett are on my mind because we could have done a better job for them. Right? And he's no longer with us. His life cut way too short at only 20. So this is Courtney. Her dad, Doug, is a dear friend of mine and runs our New Hampshire chapter. The thing that when I talk about that gap, that enormous sort of cavern that almost feels like it's getting bigger, not smaller, between what we know with all of you scientists and clinicians and amazing folks with the rest of the public. They were told when their daughter started struggling, at first there was marijuana use disorder, alcohol use disorder, and it escalated to opioid use disorder. They were told, you need to let these things run their course. She'll get better and find help when she hits rock bottom. This is the advice. And then they sought help from their insurance company to find treatment, and they were denied, saying that she had to fail first, that this was not life or death. And then they sought some help from other folks about how they could provide care for her without having insurance coverage. And they were told that it would be best if they kicked her out of the home to make her homeless, so she would be able to access homeless services that had SUD care. And Courtney died a day later on the streets, homeless and by herself. Her family never heard of the word MAT, or medication-assisted treatment. They did not know that there were OTPs and Data 2000 waiver doctors right there in their own community. They were met with this troubling constellation of myths and misinformation and misconceptions about this disease space that meant that they did not have the right guidance on how they could provide a care plan for their daughter, and they lost her when she was 20 years old. So I think that how we approach this, to know that those things that are missing in the translation to the general public and the community are so critically important. And those misinformation, those misconceptions, the magic door at 28 days, that you're magically cured. Do you know how many treatment centers will tell you that you will be cured when you leave, that your graduation date means that this issue is over? There's so much that we need to do to improve this. These are my parents. This is my why. This is year 27 for me, and my mom and dad began struggling with substance use disorder when they were just teenagers. Come out of homes with alcohol use disorder, and they were not met with the care that they needed. I lost them far too early, and this is not a new issue. It's just getting more complicated, and we need to make sure that we bridge the gap on knowledge. So I'm running out of time, strangely enough. I feel like I have so many things I wish I could share. The big pieces are how do we inform this community and the public of families and folks that are out that need access to this information. We're currently running surveys of attitudes and belief around addiction, and we're finding that typically in each state, and there's some range, but only about 40 to 55% of people believe this is a health condition. They think this is a decision, not a disease. So we need to remember that while we're constructing this, because there is a lot of awareness and information that we need to put out there. And sometimes the work that we do, and even folks in this field, can make stigma a little worse. When you talk uncarefully about medication-assisted treatment and about the benefits of an antagonist versus an agonist, you can actually stigmatize medications and using medicines to treat this illness broadly. All these providers that talk about detox, when we know that that is so dangerous for any of our families and patients to consider detox as a first option for an opioid use disorder, how do we make sure that our families and our patients understand that and have access to better information so we can dispel the myths and the misconception and make sure that families find real care and real solutions instead of that stigma? And one sort of example is most of this country right now, when we're talking about this, it's bloodletting and leeches. Right? It is so far behind the advancements that we've heard about today and yesterday, because we need to make sure that they know how to find this information. The other thing I'll leave you with is there's nothing more powerful than a worried mom or dad. Right? And this is a disease that begins in adolescence. About 90% of those patients that we work with, they start struggling or using when they're in their teenage years. But we have built a treatment system for adults. So in essence, we wait for this to worsen before we intervene, and we are mired in myths that keep people from seeking the care they need once their loved one starts beginning to struggle. So those are top of my wish list. I have another couple items I can share afterwards about our research priorities, but there's a lot that's needed, and as we make advancements in the bubble and talk about this, it really needs to translate into the wider community for this to have the impact that it needs to make.
Thank
Thank
you.
you so much.